Hi everyone, today I'm going to discuss about why dentists fear about full mouth reconstruction. I have one of the dentists asking me the same question. I know that dentist very well and he is an amazing clinician. He can do really nice dentistry. I've seen his dentistry, but still he had a fear of jumping from few teeth dentistry to a full mouth reconstruction. And one of the main reasons is fear of failure. We don't want to disappoint our patients. You don't want to fail. You don't want to do a treatment where it doesn't work out, because many dentists feel that they have lack of knowledge, because many of the courses, they are geared towards giving you a good overall knowledge, but not many courses are geared towards teaching you full mouth reconstruction from start to finish. And this is the reason dentists feel that they are out of depth, even though they have done certificate courses, but they don't feel comfortable in doing full mouth reconstruction. The other reason is that they feel there is a lack of support after the cases. So, for me, the best way I learn is someone sitting next to me and training me and teaching me when I'm doing the treatment. And that's the best way to learn. And that's why I invest heavily in calling mentors to my practice and seeing them doing the treatment, or asking them to watch me doing the treatment and tell me what am I doing wrong. And investing in mentors is always worthwhile. Many dentists believe that full mouth reconstruction is only for specialists and not for them. And again, I think this is a misbelief, because general dental practitioners are very best geared towards doing full mouth reconstruction, because we are the one who see the patients day in and day out. We have most cohort of patients we see. I'm not a specialist, so although my practice is quite limited in doing implants and full mouth reconstruction, I'm still not a specialist. But many patients feel comfortable seeing general dental practitioner because they've been seeing them for years and they don't want to go somewhere else. This was one of the main reasons I went and did my MSc in conservative dentistry from Eastman, is because I had so many patients who wouldn't go to anyone else, even though, I told them that the specialist is very good and, they can do the nice treatment. They felt so comfortable with me that they were most of the time they will say, either you provide me a treatment or I'm not having any treatment done. And that helped me taking that step further. Many dentists are worried about financial aspect. Two aspects. A, they're worried that they need to pay a lot of money in order to learn the skill. However, the problem is that if you don't learn the skill, you will not be able to recoup the benefit of the skill. So even though you need to pay 1 month, 2 months of your salary, the skill is going to stay with you forever. Okay, and you will definitely make your money's worth. Especially with full mouth reconstruction, you only need 1 or 2 cases in order to pay the money back of the courses you've done. So I wouldn't worry about investing in yourself. Many dentists are worried that their patient may not be able to afford the treatment. Now, I have been working in 11 different practices and I have seen different demographic from central London to very rural part of UK. And I can guarantee you that there is no part in UK or anywhere else, wherever you're practicing, where patient cannot afford the treatment. It's just that you need to show them the value of your treatment and you need to have that rapport build up, because if patient feels that there is a value in them, they will find money. Obviously, there is a complexity of treatment, which means that sometimes there is not enough tooth, there is not enough space to restore the teeth. You need to increase OVD when you are occlusal vertical dimension, when you're doing full mouth reconstruction. You have number of teeth that needs treatment. So it becomes quite overwhelming. So my top 3 tips, if you want to start doing full mouth reconstruction, is that with appropriate training, I truly believe that anyone can do full mouth reconstruction. I have plenty of students who I have taught with very minimal experience, and they are now doing full mouth reconstructions with comfortable. When you are doing full mouth reconstruction, I would say start with adhesive full mouth reconstruction. It is simpler. You know how to bond, you know how to deal with single teeth. And if you're doing adhesive using composite resin, then there is room for error and you can adjust a few things. So, it's lesser risk. So if you haven't done any full mouth reconstruction, I would say start with doing adhesive full mouth reconstruction. And that's what my course is geared towards, because I feel that that would be the first step. Start always small steps, refine your technique, and then start doing indirect restoration. Make sure while you're doing that, you improve your single tooth dentistry to a next level. Make sure you're really good at bonding technique, and make sure that your single tooth dentistry is really good, because ultimately full mouth reconstruction is nothing but restoring 24, 28 teeth, single teeth at the same time. So the only difference is occlusion, and that's why again my course is heavily geared towards learning occlusion, because that's the fundamental difference between multiple single teeth versus full mouth reconstruction. So I hope you found this video useful. If you have, please share with your colleagues and friends. If you have any questions, or if you want to discuss about some of my courses, please get in touch with in social media, or contact me from my website www.drdevangpatel.com.